Hi everyone. So today we're going to talk about chapter 52 or drugs that affect the urinary tract and the bladder. So, what is a common disorder that affects the urinary bladder? Well, urinary tract infections or UTI, they're some of the most common infections, okay? Sometimes you get nosocomial or hospital-acquired infections that we get when we insert a Foley catheter. That's one of the ways that we can get a UTI, okay? Also, females are more likely to get them because they have shorter urethras compared to men's. Children also may have frequent urinary tract problems. And as I mentioned already, patients who have indwelling catheters or intermittent catheterizations put them at a high risk to develop any sort of bladder infections. Now, what are signs and symptoms of a UTI? Peeing a lot, that's one sign. Having the urgency, the need to go, sign of your UTI. Burning cessation when you pee, associated with a UTI. Chills, fever, or flank pain, which is kidney pain in the back or tenderness, okay? Also associated with a UTI. Some people might suffer from nocturia or peeing at nighttime. And older adults, they have a different presentation when it comes to UTIs. They may have confusion or disorientation. If an older adult comes into the hospital, and they're confused and disoriented, especially a female, and they're coming delirious, I want to get a urine analysis on them immediately because I want to see if they have any indications of a UTI, okay? Treatment, anti-infectives. So we can give that or drugs that block spasms in the urinary tract, that decrease urinary tract pain, protect the cells in the bladder from irritation, or treat the enlargement of a prostate gland in men. Okay, and some of those drugs include tamsulosin and some of those alpha blockers that we spoke about a long time ago. So, in summary, I know it's really hard to see this, across the lifespan, children are at risk for getting them. Okay, so if children have a UTI, we might be able to give them something like, trying to read it here because it is a little hard to see, but we might want to give them an anti-infective agent, which I will talk to you about a little later, okay? Always with most medications, we want to avoid grapefruit juice, and if they have a spasmodic bladder or they're peeing so much, we can use oxybutynin for children older than 5, okay? So oxybutynin, which you'll see, is one of the most popular drugs, okay? Once again, older adults always have precautions. We have to be very careful with them because of their renal and hepatic problems, okay? And we're going to talk about the different ones that we can give for adults. Now, here is where these different types of drugs can work. So we have those antispasmodics can work in the muscular layer. Those urinary tract analgesics really work inside the fundus of the bladder, okay? Those alpha blockers, which are used to treat BPH, work in the urethra. Those bladder protections work in those endothelial layer, okay, which is the the innermost layer, okay, where all that urine is. And the urinary tract anti-infectives really work inside of the muscular layer, okay? So, we said urinary tract anti-infectives can be used for children. Some of these are antibiotics, right? So some of those antibiotics, right, because it could be a bacterial infection, we can give bosomycin, nitrofurantoin, or trimethoprim, okay? Remember, with any antibiotic, you have to take it for the full course. If the doctor says take it 8 days, they take it 8 days, even if they're feeling better, because they can get sick again if they don't do that. They will not get better if they don't take the full course of the antibiotics. Antibiotics used for UTIs and other infections include ciprofloxacin, ofloxacin, levofloxacin, cefixime, and others, okay? And some drugs that can acidify the urine are methamphetamine. So, what about this general class of these urinary tract anti-infectives? So, we're just looking at all of these different ones as a whole, okay? Some can act within the urinary tract to destroy bacteria, right? So that there are certain antibiotics that actually kill or destroy bacteria, okay? This tryptophan works systemically, so there's a lot more adverse effects. Nitrofurantoin and sosomycin are used to treat gram-positive and gram-negative pathogens, okay? But generally, remember, these are used to treat UTIs. So if you can't remember anything, just remember, okay, these anti-infectives are antibiotics used to treat UTIs. Long story short. Contraindications, allergies, renal dysfunction. Why? Because you need to pee it out, or these medications need to work in this system that works directly with the kidneys. Pregnancy and lactation, always a caution, okay? Adverse effects, nausea, vomiting, diarrhea, anorexia, bladder irritation, and dysuria, or difficulty urinating, okay? Those are some of the signs and symptoms that we might see in a person taking an antibiotic or an anti-infective agent for a UTI. And each is going to vary with each agent, so you have to talk with your doctor to figure out which ones you're taking and what might cause what, right? Because some might even cause blood dyscharias, pruritus, or itching, or hives, and a headache, and confusion, okay? So we need to be careful with some of these, and you need to talk with your doctor about the potential adverse effects as they vary with each type. Okay, so one of the medications that we can give is fluoroquinolones, and these can cause tendinitis and tendon rupture. That is the most common types of adverse effects, okay? With these medications, those are all the ones that end in floxacin. So ciprofloxacin, gemofloxacin, ofloxacin, amoxicillin, you get the idea, okay? The really bad problem, as I said, with these, think of F, right? These are F starting antibiotics, and they cause a risk for tendinitis and tendon rupture. So your tendon is near the floor and can rupture due to fluoroquinolones, okay? Important patient education and nursing considerations include that these can cause photosensitivity, so we need to have them use sunblock and avoid the sun. They must also take these on an empty stomach or with a full glass of water, so that is what we want to teach our patients. So the most prominent adverse effects are the GI, the tendinitis or tendon rupture, and even a prolonged QT. And what am I teaching my patients? Hey, you need to have sunblock and avoid the sun. You need to take this with lots and lots of water, okay? And take it on an empty stomach to avoid these food interactions, okay? And have GI upset. Drug-drug interactions, some vitamins, some supplements, some antacids. Remember, antacids or antacids, all of those types of drugs, they don't interact well with many other medications, okay? Drugs that increase the QT interval, okay? Like ondansetron, remember, Zofran, no good, okay? No warfarin and no NSAIDs, okay? Because it can increase the effects of these, so we don't want these with other drugs. Sulfonamides are sulfa drugs. They usually have sulfa in it, like sulfadiazine. We could also have cardamoxazole or trimethoprim sulfamethoxazole, okay? And you can remember sulfa, or they even end in azole, okay? Now, these drugs inhibit folic acid synthesis. That is how they work. And when they do that, they actually slow the growth of bacteria. That's why they're also called bacteriostatic. So, they prevent the synthesis of folic acid, and folic acid is susceptible to bacteria. So if we prevent that folic acid, we prevent bacteria buildup. So pretty much you're noticing a trend that these urinary tract anti-infectives can help with treatments, can be used to help treat things that are gram-negative or gram-positive bacteria, okay? And they're inexpensive, so that's pretty good. So they get to the human milk, so no lactation. They're absorbed in the GI tract, so we have to be careful with the GI system. And they're excreted in the urine, so we got to be careful with the renal system. So, right, renal disease or a history of kidney stones, a no-no. Pregnancy, lactation, contraindication. Remember, if you have an allergy to any sulfonamide or to a thiazide or loop diuretics, they're related, especially those thiazides. So no sulfonamides if you have a thiazide allergy, because they're related. Adverse effects, GI effects. So we want to take these very precautiously, okay? Nursing considerations is you want to take lots and lots of fluid, okay? And we don't want to take these with food, okay? So not with food, but with lots of fluid, okay? So we can prevent any GI upset. Problem, they can cause bone marrow depression. That means low RBCs, low WBCs, and low platelets. So we need to really, really watch out for our blood values, okay? It can also cause photosensitivity, like the fluoroquinones, okay? So if it can cause photosensitivity, we got to tell them what? Wear sunblock, avoid the sun. We also want these patients to increase fluids, and they should take folic acid daily because folic acid helps with increasing your red blood cells. And since these block the synthesis of folic acid, we want to tell them to increase that. We have to be careful also with these drugs with anti-diabetic agents like sulfonylureas because these two act very similarly. They're like cousins. Once again, watch if that patient has an allergy to thiazide diuretics. Okay? Medications that can increase the risk of hyperkalemia and cyclosporins. Cyclosporins kind of react with everything too, so that's also why we have a drug-drug interaction with those. This is just a summary of the prototype drug that we talked about before for those general like urinary tract anti-infectives, okay? So just UTIs due to some bacteria. They block the formation of gram-negative bacteria, leading to cell death. If they cause cell death, they're bacteriocidal, which means they kill them. And it can cause headache, dizziness, nausea, diarrhea, and vaginitis for the prototype for anti-infectives. This is not a sulfonamide or, like I said, the fluoroquinones. It's not one of those, okay? Now, we also have urinary tract antispasmodics. Antispasmodics means it helps with bladder spasms because when you have bladder spasms, that's causing you to go to the bathroom more. And the commonly prescribed antispasmodics are anticholinergics, which means our anti-SLUD comes back. That's what our adverse effects are. The most common one is oxybutynin, but we also have flavoxate, tolerdrine, fesotride, all of these other ones, trospium, but the most important one is oxybutynin, okay? So remember, it's antispasmodic, it's anticholinergic, which means it's anti-SLUD. So it blocks the parasympathetic system, which helps prevent peeing as much as you do, because it's going to help suppress that overactivity. Because these patients who have spasmodic bladders, they have overactive bladders, they're peeing a lot. Okay, so they block the parasympathetic, which relaxes the bladder and helps you pee less. Indications, bladder spasms, or overactive bladders. Okay, that's the primary thing. Remember, the prototype drug is oxybutynin. They're rapidly absorbed and metabolized in the liver, excreted in the urine, which means contraindications, liver problems, watch out for kidney problems, okay? Watch out for pregnancy and lactation. Watch out for allergies as well. And also obstructive urinary tract problems. Why? If these patients are having problems peeing, these are not going to be good. Also, myasthenia gravis is a cholinergic treated disorder. Myasthenia gravis, remember, it causes muscle weakness, and we use cholinergic drugs to treat it. So we're not going to give an anticholinergic like drug to someone who has myasthenia gravis. That's going to be a problem. We need the parasympathetic stimulation to help relax those muscles, and they're not going to get that if they're taking this medication while they have myasthenia gravis. Once again, we already said the cautions, pregnancy, lactation, renal, hepatic, right? Adverse effects, remember, anti-SLUD, so anti-salivation, lacrimation, urination, defecation, digestion, okay? Drugs, phenothiazines, haloperidol. Haloperidol pretty much interacts with everything too, so we have to be careful with that. Haloperidol, just to tell you, is an antipsychotic. Remember, prototype, oxybutynin, it's an anticholinergic drug, so it helps with the overactive bladder and bladder spasms. And the adverse effects are anti-SLUD. So we also have urinary tract analgesics, ones that help with pain, because urinary tract infections are very uncomfortable and very painful, okay? So what we give is phenazoparide, which is a dye to help relieve urinary tract pain, okay? So essentially it's a topical analgesic, right? So it goes on top of the urinary tract, you kind of rub it in there, and it helps relieve symptoms of urinary tract irritation from infection, traumas, and surgery, okay? So, very quick, metabolizing the liver, excreting the urine, so always watch out for kidney and liver problems and allergies, okay? Always watch out for pregnancy and lactation when it crosses the placenta and enters human milk. So, adverse effects, GI upset, headache, rash. Tell your patients, okay? Hey, reddish orange coloring of the urine is going to be normal and it could stain your contact lenses, so be careful with those, okay? And we don't want to use the drug longer than 2 days because it can cause renal and hepatic toxicity. Not really many drug interactions with that one, so it's not too bad, okay? So, I said we want to tell them, hey, you know, orangey red colored urine can be normal, okay? But we don't want you to take this more than 2 days because it can cause renal and liver problems. Once again, it's used for pain. This pheno this phenazoparin is used for relief of pain to help with that urgency, burning, frequency related pain that you're getting from the UTI, okay? Remember, adverse effects. Headache is normal, rash, yellowish tinge to the skin can also be normal, but that could also mean that we're having liver failure, okay? So that's why we don't want to take it more than 2 days, okay? So if the skin's starting to become yellow, that means it's starting to get into the liver, okay? And we want to tell them, hey, reddish orange coloring of the urine can be normal and can also stain the contact lenses. We also have, lastly, bladder protectants, okay? So bladder protectants are used to coat. Remember those GI protectants? They kind of coated it like a Band-Aid. This is what this is, what I said. It kind of gives a little Band-Aid from that irritation that we get from the urine that's caused from that UTI, from that bacteria. And what we usually give is pentosan polysulfate sodium. So it's a heparin-like compound. That means if it's anticholinergic and it's related to heparin, that means we're at risk for bleeding. So we have to be careful. We have to put these patients on bleeding precautions, okay? And as I said, it's a Band-Aid. So it adheres to the bladder wall of the mucosal membrane and it controls that cell permeability. So it helps with decreasing that pain and protecting it from all that very acidic environment that's coming from that UTI infection, okay? It decreases pain or discomfort from interstitial cystitis, okay? So, as I said, it's distributed to the GI tract, liver, spleen, so we have to be careful with the liver or renal problems. Remember, it's a heparin-like drug, okay? So it's related to that, which means we have an increased risk of bleeding problem, okay? Contraindications, history of heparin-induced thrombocytopenia, a low platelet count. Once again, bleeding precautions, bleeding precautions, bleeding precautions. That's the most important point that I want you to take away from that. It's a bladder protectant, but it causes increased risk of bleeding, okay? So remember, bleeding can lead to hemorrhage, so we have to be very, very careful with that, okay? Drugs, no anticoagulants, aspirins, or NSAIDs, those are going to increase the risk of bleeding, okay? So this pentosan polysulfate sodium, it helps with bladder pain by being a bladder protectant, helping the bladder wall work as a buffer to help with those irritating solutes that we get from the UTI, but adverse effect, main one, bleeding. So the last thing I want to talk about are drugs that treat benign prostatic hyperplasia, which means the prostate enlarges, making it hard to go to the bathroom. So things that we get from this is they have discomfort, they have difficulty in initiating urine. It becomes really, really hard to pee. You feel really bloated because you can't pee, okay? Now, the drugs that we typically give are alpha adrenergic blockers like doxazosin, tamsulosin, alphazosin, citidosin, and terazosin. They all end in zosin. They're alpha blockers. Remember those alpha receptors? Sympathomimetics normally, especially the alpha ones, they cause vasoconstriction, but they prevent you from peeing. If we block the alpha 1 receptors, we're causing you to pee. These block those alpha 1 receptors. If we block the alpha ones, we're causing urination. So therapeutic actions, depends on which drug. Usually tamsulosin, doxazosin are like the drugs of choice. They treat benign prostatic hypertrophy, okay? Contraindications, allergies. Always caution with hepatic and renal dysfunction. We're seeing that always, right? Also, if they have even more urine obstruction, that won't be good. Adrenergic blockers, you always have to be careful with heart failure or coronary disease. And remember, they're alpha blockers, so we're blocking the vasoconstriction, which means we're causing vasodilation. So we have to be very, very careful because they can have really bad low blood pressures. Remember, we have to also watch out, tell them to change position very slowly. And some of these can even cause erectile dysfunction. So we have to be very careful with that. There's also testosterone blockers that are part of benign prostatic hyperplasia. They treat these like finasteride or detasteride. Okay, with these, I just want you to know that we don't want to take saw palmetto. It's a type of herb that can interact with these medications. But the drug of choice is doxazosin. It's an alpha-1 blocker, which means it blocks those alpha-1s. So we block that vasoconstriction, means we cause vasodilation, we cause hypotension, and we also are helping you go to the bathroom. So we want to tell them to change position slowly. Remember, any sort of alpha block, a beta blocker, we always have to watch out for tachycardia, okay? This can have reflex tachycardia as a result of causing hypotensions with these alpha blockers. Remember, beta blockers, not so much. They actually prevent reflex tachycardia, but the alpha ones don't. The alpha ones, because of that orthostatic hypotension that they cause, you get reflex or compensatory tachycardia or palpitations, okay? They might experience that, and we have to be very careful. We might want to even hold this medication if they have a really high heart rate, okay? It could even cause sexual dysfunction or erectile dysfunction, and especially in our male patients. Because remember, benign prostatic hyperplasia is for men. Women do not have a prostatic gland, okay? And that's it.